Welcome to the Healthcare Technology Report, a leading information source on healthcare technology companies and solutions. In this episode, we speak with Effie Carlson, CEO of Watershed Health. Watershed Health is a care coordination and interoperability platform focused on turning healthcare data into action across the handoffs where care often breaks down. The company connects EHRs, claims, case management systems, and paper-based workflows so health plans, at-risk providers, hospitals, post-acute organizations, and community partners can coordinate around the same patient in real time. Effie became CEO of Watershed Health in January of 2025 after serving as the company's chief strategy officer. Over more than 16 years in healthcare, she has worked across provider operations, health plans, government programs, and community-based services. I'm your host, RJ Lumba. We hope you enjoy the show. If you like the episode, click to follow. Effie, thank you so much for taking the time to chat with us today. It's a delight to be with you.
Thank you so much for having me.
So we've had a decent number of folks on related to kind of the healthcare data space. And so it's always interesting to see how the various solutions out there address certain needs, whether they're kind of broad, across the system or whether they're point solutions. But maybe let's start off with what Watershed Health aims to solve.
Yeah, so we are focused more on the action side of data. So, I think so much of the conversation today related to healthcare information is how do we just bring it together and put it in the same bucket and have the information in the bucket be the same material. I think that's where a lot of the focus is. We know that that's just the starting line, not what we're actually trying to accomplish. And so what we do is bring together information from disparate systems, including paper-based providers, but we're really focused on automating that work out for the purposes of care coordination and gap closures and the different things that have to do with the clinical side of the work.
And then, I think it'd be interesting to get a little bit about your background, because you've had a lot of good experience with various companies leading up to Watershed.
Yeah, I always tell people I'm a little bit of an unusual person because I've sat in almost every seat at the table. Started out my first company, I built a practice management software in my 20s, and it was as a result of sort of my own healthcare experience. I had twins that were born early and then in the NICU for 4 months. So I got a crash course on the importance of your doctors being able to be a doctor and not spending their time worrying about coding and those kinds of things. So I sat in that side, for that provider point of view, running front and back office operations for clinical groups. Then I went to the health plan side where I got a perspective on how health plans and how they're thinking about solving some of the similar problems. And every seat that I went into in my own consulting company sat in the kind of SCOH space, I ran into the same issue over and over and over again, or the same need, where the opportunity was the same. We get so far into a strategy or to an approach, and it was the space between all of the systems. It was the space between the levels of care, handoffs between things that kept breaking. And so when I met Watershed, I said, you kind of are doing a thing that is sort of the universal need. And I got really excited about what we were doing here.
Mm-hmm. And maybe to bring it more to life, can you share with us, maybe some examples of the organizations you work with?
Yeah, so we sit kind of similarly to what my background is, where we sit in all seats at the table or maybe in the middle of them with all the different people. So we work with health plans or anybody who's taking risks, to health plans, at-risk physician groups, ACOs, and those kinds of folks. But then we operationalize the work between the providers themselves. So hospitals and post-acute providers, clinics, the ancillary space, so think like DME or even the COH space, like non-emergency medical transportation. So if you're in the business of or adjacent to the care of a human being or responsible for the math, you're a Watershed participant.
Got it. And so I imagine you're helping to connect existing, software solutions or existing databases or data management tools. And so is it the case where you're not necessarily replacing software, you're kind of sitting on top or sitting in between?
Yeah, it's the in-between. So we agnostically connect with the system that traditionally in healthcare, people think about that as EHRs, but it's also population health systems or case management system. And then again, for the people who their system is a pen and paper, that's their system as well. And we bring all of that information together, but then also allow those systems to work with one another, the thing that they have in common, which is the patient.
Hmm. And how's it been going? Can you tell us a little bit about the evolution of the company, how it's been growing over the years?
Yeah, so it was actually started by an interventional cardiologist down in the southern part of Alabama. He was started out solving a problem for himself because he, like me, was seeing the same issue. You kind of pass the ball to someone else and things fall apart, and then you're held accountable for an outcome that you didn't control. And so he started Watershed from that point of view. And since then, we're technically in 14 states, but we're really focused right now on 4. So down in the Gulf Coast of the United States, the central part in Texas. And then we have about 12 million patients or so in the app now, and it's growing pretty steadily.
Hmm. What's currently the biggest challenge in scaling the business?
I think anytime you do anything in, especially data spaces in healthcare, it's belief. Um, I think so much of healthcare has spent a lot of time being promised a lot of like amazing things that are going to change the way everything works, and you're going to finally kill the fax machine, and you're going to finally get off the phone, and you're going to finally do whatever the promise is. I think when we come into marketplaces, the first bit of time we're spending with our customers, the people who are participating, is really helping them understand that this is not a really great PowerPoint deck. It's an operating system built by people who lived the broken handoffs, not both on the clinical side and then on the business side, and all have been on the receiving end of people's bad ideas. So we were a very tactical group. But I think that's probably the biggest one to overcome at first, is that things don't have to be the way that they are, and we can do it differently. Then when you get to there, you get to just, when you do what we do, it's a complex thing because there's so many different endpoints and people that are involved. And so it's just bringing all the people together so the systems can do their job.
And so the sales process, I can imagine, can be a fairly long sales cycle, and it takes a while to educate kind of the target buyer.
Yeah, yes and no. I mean, we always find clusters. So whether the cluster is happening at the health plan or sort of aggregator level, or a large system or a large practice or physician group or whatever it may be, you just need a nucleus.
Mm.
And once that happens, it rolls pretty quickly from there. It's just that first kind of place to plant the flag is the place that's hardest. We generally get brought into communities versus us entering communities. And so that also helps accelerate that cycle. But yeah, I mean, whenever you're dealing with that many endpoints, you're doing a lot of talking, connecting, and training.
Hmm. How are you leveraging AI, I guess, internally with your own software, or solutions development, as well as baking it into your offering?
We are doing some work with it, mostly on the data normalization side of the house. We purposefully are staying away from some of the things related to the clinical use cases because of where we sit and sort of the neutrality space that we play. How we think about AI is a data source into the AIs that the endpoints are choosing for themselves. Because we have a neutrality point of view on purpose, is I think one of the things that technologists miss in healthcare is that it's endlessly nuanced, and the idea that the world is going to just rip and replace systems to be on one magical thing that's going to cover all of the infinite nuances is naive. So we feed systems that the providers have chosen for themselves, the covered entities have chosen for themselves. And I think that's how we'll continue to leverage AI.
Hmm. Can you tell us a little bit about the team over at Watershed? You mentioned the founder, but you probably also have like great management team members.
Oh yeah, no, we were building a great team. We just brought on our new COO, Melissa Binkley, who was one of the founding team members at Cohere, one of the other unicorn companies here in the United States. Monica Rivera, who's our CGO, our Chief Growth Officer. She's formerly ran strategic solutions on the community and state side of the house. Also is a physician and teaches at Harvard. So we've got a rock star team, like people who every day I'm grateful decided to come do this.
Hmm. And then in terms of capital partners, who help you scale the business, can you tell us a little bit about the value that they've brought to the table aside from capital?
Oh, yeah. I mean, I think one of the most important decisions you make when you're a growth organization is who you decide to take money from and who you decide to partner with. And partnerships, I think people don't think about investors a lot of times as partners. And I think one of the things Watershed has going for them is that we've got a really great group of investors and partners. on the Create Health side, they've done an amazing job. They rolled their sleeves, get in there and work alongside of us. SDA does a fantastic job in helping connect us into places that we can, sell into and find partnerships. And then First Trust has just been similarly like roll up their sleeves. We're really lucky on that front. So I think you always have to have people who are not only invested in your financial growth, but in the growth of your team, your product, and how that fits in the grand ecosystem. And we've got that across the board.
hmm And, you mentioned the different geographical areas you're in, and maybe there's a little bit more concentration in the Southeast, but can you tell us about your plan for expansion? Like, do you do it by kind of geography? I mean, you mentioned you look for these clusters, but
Yeah, so there's two pieces that happen. One of it is you grow through adjacency. So density is a thing for how we work. And so, that's the reason we're in the Southeast is because we started in the Southeast and it just sort of spread on its own. So, being rooted in Alabama brings Louisiana, Mississippi, Tennessee, and that kind of cluster. And then we get brought to markets with partners. So we are in Indiana, and Ohio is an expansion market for us in the near term, Missouri, and sort of that Midwestern cluster. And then we got brought to Texas. And so we look at Texas, New Mexico, Oklahoma, places like that. So it sort of spreads in that way, sort of organically. And then there are times when we get pulled into a market and then it expands organically in the same way.
what do you foresee happening in the next 3 to 5 years? Is this like continued expansion of Watershed? Do you foresee, some major partnerships? Do you foresee a potential sale and an eventual like big capital round? Like, how does the next 3 to 5 years look?
Yeah, so partnerships on the growth side, we've got a couple in the final that we'll be doing announcements here, hopefully by the end of this year. On the capital raise side, we'll be raising our Series A here in the next year or so. And then from there, it's just grow some more. We're a venture-backed company, so that's all we do all day long is think about how do we scale faster? How do we, proliferate in the markets that we're in? How do we go deeper with providers that work? How do we service them better so we can achieve our mission, which is to kill the fax machine, kill the clicks, give the time back to the provider to do the work we want them to do. Software should make you more human, not less human. And I think we're so focused right now on replacing things, but it should just be working underneath the work that we need people to do.
Are there other solutions out there that are directly comparable to Watershed?
There are definitely people that we overlap with from specific components of what we do, right? So on the data aggregation side, you've got a host of folks that are sort of solving for bringing disparate data sets together. Traditionally, they focus on hospital systems as like their primary place. So we have a data aggregation component. We've got some groups where, we look at referral platform or transitions platform of what we do. There are folks that obviously do transition referral platforms. The places that we're differentiated the most are, I was told by a health plan CEO once, they were questioned, they said, what stupid stuff do you get compared to? Because I've never seen such a complete train of thought.
hmm
That's the differentiator. I think that so much of what has been going on in health tech for the last 15 years has been a point solution focus. And I think that everyone's coming to terms with the reality that healthcare is an ecosystem and you need ecosystem solutions. And so not really anybody that does it directly the way that we do it, but definitely some overlapping places.
As CEO of Watershed, do you have some like guiding principles that you abide by, meaning like how you like to lead a company, maybe in some cultural elements you like to kind of impart on the organization?
Yeah, I think you have to have everybody understand and be in it for the mission of what you're doing, especially at this stage. When you're an early stage company, it's hard. And you get to be a little bit like on a roller coaster. You're like, we're changing everything. No, we're not. Yes, we are. No, we're not. And it just sort of comes along with it. So if you're not passionate about what problems you're solving and why you're in it, you'll struggle. So
hmm
that's one, is you have to have people oriented to the same. So what? The second piece, you have to like each other a whole heck of a lot. I think people don't pay enough attention to just personality mix, because when things are hard and you're on that moment in time when you're like, this is not great, to remember that like, oh, but I like that person. Like I enjoy them as a human being, not just as a, rock star or whatever employee. Like, no, we have to like each other. So we spend a lot of time making sure that those components of just sort of the humanness of who we are and what we do stays embedded in it. And then I think the other piece with that is also how we treat our customers. We never forget that they're humans. They're not people, numbers on a spreadsheet. When we do that, it permeates the culture, because I think, again, when you're kind of heads down doing things that are arm's length from the work of healthcare, you can kind of sometimes forget that you work in healthcare.
Hmm.
So those are the things from a cultural point of view. The other thing is that you never leave anybody alone in a foxhole. So something needs to be done. I don't care who you are, you're going to roll up your sleeves and get it done to make sure that we execute on the things that we need to execute on.
Are you set up as a remote company or hybrid in person?
We're primarily remote. Yeah. So most of us live other places. We come together on a decent cadence, but we are all remote today.
Hmm. Excellent. We're coming up on the tail end of the conversation. I have two final questions. One is, can you tell us about a person who has had a profound influence on you?
Oh my gosh. I mean, it's not a famous person, but when I was 17, I worked in a jewelry store in Old Town Scottsdale, and it was my first like real job. And there was a woman there who became a lifelong mentor. And one of the things that she helped me understand was, well, one, I watched her sort of move through the world and how she engaged with people in a business setting. It changed my mind about how sales worked, how the fundamentals of business work. And then sort of her genuine belief in me as a person, I think really reframed how I saw myself and set me off on all the weird paths that I've been on in my life. And she's probably been one of the most influential people for me. And I know I probably should have said something sexier, but that's, I think, the person who's probably been the most impactful for me as a human and a business and a professional.
That's great. And I think I saw early on in your career, you were in politics.
Yeah. Yeah. I ran for office in 2014 in Arizona. So similarly to sort of, I like complicated things. I like government and healthcare because it's complicated and consequential. And yeah, it was an amazing experience. I'll do it again someday. I recommend it to anybody. I think you learn a lot about yourself. You learn a lot about your community. It was amazing for a personality like mine because people come to you with their issues and information, and I just like to know things. So you're just kind of on a endless receiving end of just people going telling you about weird stuff and then being able to figure out how it all comes together. Similarly, what we do at Watershed, take disparate information, put it together, make it work for a community. Yeah, it was really an amazing experience. It's so fun.
I usually end with like a charity cause or other endeavor you're passionate about, but maybe because like I feel like I got a sense for that, maybe tell us about a hobby, like something you enjoy doing outside of work.
Well, I was in a choir for 10 years, so I love to sing for soprano in the choir. And I do ballroom dancing. So I recently was working on the tango is what I've been focused on, but I like those kinds of things. And then when I was a teenager, I was more like a musical theater kind of person. So I'm one of those people.
That's awesome. The tango, is that Argentina? Is that where you go to like really watch great?
Well, there's the Argentine tango and then there's the regular tango. So the Argentinian tango is like a improv thing. And then you have the more structured tango, like the one you see in all like the James Bond movies. You know, I was starting on the structured side so I could get to a place that eventually I could do the Argentinian tango. And by the way, I'm not amazing at it, but it's a really fun and kind of ridiculous, amazing thing to do. And it's a skill that, you know, who knows how to tango, right?
Right.
Like, what did you do? I was learning how to tango.
Can we find you on TikTok or YouTube?
I hope not. But in today's world, who knows? But I hope not. Yeah.
Well, Effie, want to thank you again for taking the time. It's been a great conversation.
Absolutely. Thank you so much.